Hi, I'm Dr. Lexi Frydenberg, General Paediatrician. I work both in private practice and have been working at a major Victorian paediatric hospital for over 20 years. I see children from age 0 to 18 with a broad range of medical and developmental issues. Now I'm going to talk about common newborn issues from 0 to 3 months. The first issue that we often get referred in the newborn period is difficulties with feeding and poor weight gain of babies. It's normal for babies to lose weight when they go home after birth, but if they lose more than 10% of their birth weight, you do need to get your baby checked. Most babies regain their birth weight by 1 to 2 weeks. If your child hasn't regained its birth weight, it could be for one of 3 reasons. Your child might not be getting enough calories, enough intake, and that may be an issue with feeding if you're breastfeeding with poor supply or poor attachment, but it also might be difficulty with feeding if your baby's on the bottle. This by far is the most common reason why babies do not put on weight or lose weight after birth. The second reason is an absorption issue, which is much less common. And the third reason is if your baby has excessive losses. So this could be vomiting or diarrhea. But the most important point is if your baby has lost weight or failed to regain its birth weight, you need to get your baby checked. And our maternal child health nurse system in Victoria is great for this. They do regular weights and check-ins when needed. With babies, they may need top-ups of either express breast milk, so EBM, or formula. And that's okay because your baby's health is what's most important at this stage. We do recommend introducing solids between 4 and 6 months of age, and that's to decrease the risk of allergy later in life, but also decrease the chance of iron deficiency. So nutrition in your baby and in your infant is really important. So another common issue in newborns is vomiting and irritability. All babies vomit, but some more than others, and it can be extremely messy. The vomit is due to reflux, where the stomach contents goes up the esophagus, which is the feeding tube, and might go into the baby's mouth and they may vomit it out. Sometimes this is called positing. If your baby vomits milk, that's quite normal. But if they vomit any blood or bile, which is bright green, that's a paediatric emergency and you need to take them to hospital. So vomiting's quite normal and it does improve with age, and most kids have stopped vomiting by the age of 1. Most children with a degree of reflux do not need treatment apart from conservative measures such as feeding them upright and keeping them upright after feeds. But in some children, it can cause difficulties. The children that have difficulty with vomiting are those who are very irritable. They may not put on weight or lose weight, and they may end up gagging or choking on their vomit. If any of those things happen, you do need to take your child to the doctor because your child might need some treatment. So some babies who vomit may have cow's milk protein intolerance or cow's milk protein allergy. This is different than other allergies you might hear about where a child has a peanut and has an immediate reaction. The cow's milk protein intolerance or allergy is a delayed reaction, and it's usually related to the gut. It's what we call a non-IgE mediated reaction. So babies with cow's milk protein intolerance present with vomiting, diarrhea, irritability, and eczema. Sometimes these children will have blood in their bowels or mucus. And if you're worried about your child, you should take them to get checked. Unfortunately, we have no test for allergy for this type of allergy. So our skin prick tests and our blood tests are not helpful when there's cow's milk protein intolerance. The only way we can tell if your child has this is by an elimination diet. So either the mother who's breastfeeding eliminating cow's milk protein strictly from her diet, or if the child's on formula, having an extensively hydrolyzed or cow's milk protein-free formula. What we usually do is recommend elimination and then reintroduction after several weeks. But I would strongly recommend this is done in conjunction with your doctor or your maternal child health nurse or dietitian, because you really need a good plan for elimination and a good plan for reintroduction. Because your health, the mother's health, is really important also, and you need to make sure that you've got the appropriate nutrition and supplements. Another issue we get referred as paediatricians is jaundice in newborn babies. Jaundice is when babies get yellowness of their skin or the white of their eyes, called the sclera. And jaundice is really common. Most jaundice doesn't need treatment and is not harmful. Normal jaundice, or what we call physiological jaundice, usually starts on day 2 or 3 of life. It peaks on day 5 or 6 of life and usually settles within 1 to 2 weeks. But if there are red flags, if your child has jaundice less than 24 hours after their birth, or if the jaundice lasts more than 2 weeks, if they have pale poos or dark wee, or if they're unwell or getting more yellow, you do need to get your child checked. They will then see a doctor, have a blood test looking for a bilirubin level, and that is what causes the jaundice, and they may need treatment. But be assured, the treatment for jaundice is really easy and safe. It's usually what we call phototherapy or light therapy, and it can often be done at home.